Doctors at Regenerative Orthopedic Center, or ROC, say they see an increase in weekend warrior injuries this time of year. Today we are talking to board-certified orthopedic surgeon Shane Hanzlik about these types of injuries and how they're treated. Today we're talking weekend warrior injuries. What are the most common types of weekend warrior injuries you see here?
By far, it's going to be knee and ankle injuries. So usually the most problematic one is going to be a knee meniscus, where somebody that's not that active during the week gears up and gets ready to go play basketball or tennis on the weekend, and they'll do a twisting motion and sure enough feel a little snap or twinge in their knee, and it ends up being a torn meniscus, and we have to do something about that usually.
You do a lot of shoulder surgeries, hips, knees.
Yep.
When does someone need surgery? When should they not be pushing past the pain and they need to see a doctor?
The obvious things where if you can't move the extremity very well without it just killing you, that's you got to come in and see the doctor. But if it's really preventing you from having full range of motion of that joint, and especially for more than, let's say, 1 week, you should probably have it evaluated.
But you have a lot of patients who come in and you say, oh, we don't need surgery, we can treat this more conservatively.
For sure. Probably 80% of our patients are non-operative. And most of those are things that we can take care of with simple medicines or injections, and sometimes sending them to physical therapy.
How important is physical therapy?
It's probably going to be the mainstay of not so much treating it right at the moment, but making sure it doesn't happen again in the future.
The recovery times are a lot shorter nowadays for these types of procedures.
And that's really because we've learned that the body needs to move and wants to move, and you heal better if you move it. So it's very rare now that we'll actually immobilize something for more than a couple days. Early protected motion is kind of a theme that gets everybody better.
Motion is the lotion, right?
Exactly. Well said. Whoever coined it, genius.
Dr. Hanzlik, thanks so much.
To learn more about orthopedic care and recovery at Regenerative Orthopedic Center, visit rockpdx.com.